Next up, we have Rebecca Ring, a partner in Deloitte's healthcare consulting team, specializing in healthcare strategy and transformation. Rebecca's academic background with a PhD in pharmacology and neuroscience research gives her a strong appreciation for evidence-backed, data-driven decision-making. So take it away, Rebecca.
Thank you very much, and good morning, everyone. So I am Rebecca Ring, and I'm delighted to have the opportunity to speak here this morning among many brilliant women in data science. As the introduction said, my background is in research science. I did a PhD originally in neuropharmacology, so in another life I would be up here talking about p-values, but not today. So I'm going to talk a little bit today about Deloitte's global trends in healthcare and how they align with the UN Sustainable Development Goals, and also the importance of data and data science in underpinning that. So firstly, maybe just to start with a little bit of background around the challenges that we're facing in the healthcare industry, both globally, and I think they'll resonate here locally as well. So first is the growing and aging population. So the recent census here in Ireland showed that the population of Ireland is set to grow to 5.4 million by 2030. And the proportion of that population that is over 65 and over 85 is increasing, with the over 85 set to double by 2030. I think obviously that's something to be really proud of here in Ireland. Our life expectancy is increasing, the quality of care we deliver is increasing, and that allows our population to be growing and aging, hopefully healthily. But it does place a burden on healthcare systems in general. And I think the second trend we're seeing is challenges in access to care. This has increased, I think, since the COVID-19 pandemic, and there's been a backlog in elective care. But there has also been a growing challenge in accessing primary care providers. So anyone who might be new to the country may have had challenges in getting a GP. And there's also been growing attendances at emergency departments across the country. That's actually been outpacing demographic growth, and we're not really sure why, but there has been ever increasing attendances at emergency departments recently. That is being seen globally as well. In the NHS, they're struggling with very similar things. That is also impacting on health equity. So obviously, challenges in accessing healthcare are more challenging for more deprived populations. I think technology and integration pose a huge opportunity for the healthcare system, but the growing importance of technology and data management to healthcare organizations also has an increasing burden in terms of resources to safely deploy and design, configure systems, and also to integrate and develop data in the background that can be safely used for healthcare provision. And then finally, workforce challenges. I think that's set to continue globally. So there has always been and continues to be a shortage of healthcare workers, particularly in specific disciplines. And I think we're seeing ever increasing financial challenges, particularly in an uncertain economic climate. So I think that's leading to increasing demands for care, increasing complexity of care, and an urgency to change. So in Deloitte, we conducted with our Centre for Health Solutions a survey of 121 C-suite professionals across 5 geographies in 2024. And we looked at what the trends were in terms of how healthcare organizations are addressing the challenges that they're facing. One key trend was that 70% said that they were focused on operational efficiencies and productivity changes for the coming year. I think that's something we're seeing here in Ireland as well, with the establishment of the Productivity and Savings Task Force by the HSE and the Department of Health last year to drive efficiency and productivity within the health service and cost savings as well. In order to achieve those productivity and efficiency savings, we're seeing a couple of trends globally that I think are being reflected here as well. Not surprisingly, the accelerated digital transformation is a key trend. So 90% of people surveyed said that they would be investing in core digital technologies within healthcare in the coming year. So that is electronic healthcare records, which are the basis and the foundation for healthcare delivery. but it's also around virtual health and digital tools, which have been growing since the COVID-19 pandemic globally. So the implementation of telemedicine, virtual health, and digital tools to support patient engagement. So we have been seeing that here in Ireland as well. The HSE launched their telehealth roadmap recently, and last year implemented 2 virtual wards or hospital at home type services. AI, we've just heard about from Kate, and I think across all industries it's having an impact no more than in healthcare, especially with those challenges in healthcare workers and sourcing them. So we're seeing AI playing an increasing role in reducing the burden of administrative tasks, referral management, and automating routine admin tasks, and allowing clinicians to spend more time with their patients. We're also seeing that directly supporting clinicians in the delivery of clinical care, so particularly in the field of radiology, which I'll talk about a little bit later. The second trend is valuing healthcare staff. So I think since the COVID-19 pandemic in the healthcare industry, we've really seen burnout. We've seen lots of challenges in recruitment and retention. And by 2030, the World Health Organization estimate that we will have a global shortage of 10 million healthcare workers. So I think that is an ongoing challenge. And we need strategies to address it. So one of those has been the implementation of digital tools and technologies to support healthcare workers to free up clinical time, particularly in areas where there has already been an implementation of a healthcare record, which has driven a burden in terms of clinical documentation. And the Deloitte Centre for Health Solutions has estimated that the implementation of digital tools can reduce nursing admin burden by between 13 and 21%. So that frees up time to spend with direct patient care. I think the other thing that we're all seeing is increasing patient expectations or changing patient expectations. So I guess we're all consumers of healthcare. We all now have a wealth of healthcare data actually accessible to us, particularly through the new wearables that we have. And patients have expectations about how they access services, the type of care that they receive, and the experience that they have when they do that. And what we're seeing in response to that is increasing virtual tools, so enabling patients to access care from home. Hospital at home has been a huge benefit to patients in terms of their experience of even just having their own food rather than hospital food, and increasing community-based care. So I think the HSE has invested very heavily in recent years in the enhanced community care program and bringing care closer to home. We're also seeing patient apps and patient portals becoming the norm in healthcare to increase self-management and empowerment. And the HSE here in Ireland released their patient app last year. So what's the role of data and all that? I think it's probably twofold. So the first thing is the need to ensure that there is robust data analysis to support investment decisions. So I think we all who work in healthcare know that we have the data. It's probably just in multiple places, hard to integrate, hard to analyze as it currently stands. But I think we're seeing increasing use of that data to inform strategies and investment decisions. And I think the second is addressing those silos. So having a structured, modernized, integrated data set to support both healthcare strategy and investment, and also the underlying tools like getting the best out of AI as it's implemented. And I think there's a lot of considerations there around data strategy, governance, privacy, and security as we integrate data sets across the healthcare industry. So how does that align with the UN Sustainable Development Goals? Well, I've taken one or two that I thought would be most relevant, and I think Goal 3 is a pretty obvious one, so good health and well-being. And we're seeing in the literature that technology implementation in healthcare has a real impact on patient outcomes. So the implementation of electronic healthcare records, for example, can reduce mortality in hospitals by up to 20%. And if that sounds surprising, I think a lot of research has been done, particularly around sepsis care. So the implementation of technology to monitor and detect earlier sepsis to ensure compliance with protocols, ultimately has big impacts in terms of patient outcomes. And similarly with AI, I think radiology is probably the most well-established use case for the use of AI in healthcare. To support clinicians, not replace them. But I think what we're seeing is with fracture detection and stroke detection, and in particular for stroke, improved outcomes with earlier detection through the use of AI to support clinicians. Goal 9 is one that's maybe close to my heart. I work a lot in capital infrastructure here in Ireland, and for anyone who's recently visited any of our hospitals, I think you could all say that it needs modernising in terms of the actual infrastructure. And given the staff challenges that we're having, I think having modernised, resilient buildings for our staff and patients to work in will improve patient experience. But also, given the growing and aging population, I think what we're seeing is the need to have alternative sites of care delivery. So whether that's virtual care or hospital at home, if you don't really need to be in the hospital, there should be alternatives available, and that's increasing. The final one is reducing inequities in healthcare. And I think the biggest challenges in health inequity often is the lack of data to understand population-based healthcare and to really be able to plan targeted interventions for particular population groups. So I think with the implementation of standardized, modernized data sets that are integrated, that population health planning becomes much more accessible to do. Although I think I recently was at a talk by Sir Michael Marmot in the UK, if anyone knows the work that they do on health inequity, and we're actually performing pretty well. So things are improving here since COVID, and I think they're reducing in lots of other countries. So again, maybe something to be proud of if you work in healthcare in Ireland. So finally, just to summarize, I think the importance of a strong, modernized, structured data set is crucial to underpin strategy, investment decisions, capital infrastructure, and digital transformation investment decisions. And I think the impact of strategies that are focused on valuing healthcare workers, improving patient experience, and implementing digital tools and technologies to do that will have a real impact on some of the UN Sustainable Development Goals. So, thank you.